I'm Dr. Ervind Bhogte. I went to medical school at University of Texas at Houston, graduated there in 2005. Before that, I did my undergraduate at Duke University. I studied biomedical engineering there. After medical school, I came and did my residency and surgical critical care fellowship at Washington Hospital Center in Washington, D.C. So I was there for about 7 years in total with all my training. And then since then, I've been down here for the past almost 10 years now. Sort of had an inkling of becoming a doctor starting, I guess, in middle school. Honestly, my parents had me volunteer at one of the local hospitals just as like one of the local gift shop volunteers, patient transporter, that kind of stuff. So I kind of got interested in it, and it was, it was fun. I enjoyed talking with the patients and things like that and taking care of them, taking them around the hospital. When I was in undergraduate at Duke, there was a shadowing program there, so I got to shadow some of the residents and interns there at the hospital. So they matched me up with, I think it was a surgical resident first, and then also a internal medicine pediatrics. So I wasn't really sure if I was truly interested in a subspecialty or if I wanted to do primary care. So I shadowed him a few times. He fixed me up with a couple of his friends down in the emergency room, so I spent a couple of days with them also. And it was really interesting. I got to see a lot of different parts of the hospital at Duke and then get a lot of exposure to different things. So from there, I kind of set that I wanted to go to medical school. Surgery, I didn't really decide until I was in medical school. I was about 95% sure that I wanted to do surgery once I started medical school, but I decided to try out everything. I really liked primary care, but it was a little too much slow pace for me, I think. I like the faster pace and quicker cure of surgery, get patients feeling better really quick with something that's really bothering them. So, and then from there, by the time I graduated, about my third year of medical school, it was really solidified. My training was basically in all of general surgery. So we got trained early on. In my first year of surgical training, we were exposed to urology, neurosurgery, all the subspecialties, ENT, so head and neck surgery. So we got to see a little bit of everything in addition to general surgery. Beyond my first year of training, though, we saw a little bit of that, but some of the more subspecialties of like cardiac surgery, thoracic surgery is where we got exposed to as well. So in my training, I did see a lot of different things. So I'm comfortable operating on a lot of stuff from the neck down. Trauma we're comfortable with because we did so much of it in my training. So got to see a lot of things, but for the most part, most of what I have done here has either been breast surgery, thyroid surgery, anything of the abdomen, whether it's hernias, cancers, colon cancers, stomach cancers, things like that, intestinal cancers, a lot of gallbladder surgery, soft tissue surgery, so things like little cysts, lipomas, little lumps and bumps that people have on their skin that are becoming painful, can be infected, large, they're uncomfortable to them. So general surgery is kind of a broad scope, and you get trained in a lot of different areas. My philosophy of care is basically that I like the patients to be really involved and understand what is not only going on with them, but also the treatment that we're going to design for them. So every patient's unique, everyone's going to have their unique challenges, and so I think every disease is slightly different. So I think it's nice for patients to truly understand what is going on with them, why they need surgery, or why they don't need surgery in some cases. And then for them to really understand it and for them to be involved in that decision making of actually moving forward with surgery or not moving forward with surgery. So I like them to truly understand, so I try to draw them pictures, bring out diagrams if we can, to try to really help them understand what is happening. I view my patients like family. Basically, I like to treat every patient as if and give them the same advice that I would give my brother, my mom, my dad, anyone in my family. I would offer the same advice to as to a patient. So I don't think that it should be any different when you come to see me, as if, when patients ask me, is this the same thing you would tell your mom or dad? Yes, it is. It's exactly what I would tell them. And I don't think that who you are or where you stand or how much money you have shouldn't make a difference in the type of care that you're going to get. Everyone still should have the same type of health care regardless.